Hello everybody, I am Arwa Khawaji. I will present an orthodontic treatment needed case that I did extraoral examination for her. This case represents 14 years old girl that her chief complaint was space between her upper front teeth and the next tooth over is and toward the roof of her mouth. This is the frontal view for this patient at rest, and this is at smile, and this is her profile. The first analysis is from frontal view at rest. Here the patient has a void and symmetrical face with competent lips. Transversely, the face is divided into 5 fifths, central, lateral, and medial. The central is wider than the medial and lateral, and her mouth is narrower than the interpupillary distance. Vertically, she had an increased lower facial height. Then, from the frontal view at smile, here the patient has an adequate incisor display, or her upper anterior teeth can be seen. Smile arc, which is a line demarcating the incisal edges of upper anterior teeth, is slightly flat to the curvature of lower lip. Occlusal cant, she has a roll deformity on the right, slightly up on the right side of the patient, and asymmetric gingival display. At the transverse dimension, maxillary midline is shifted to the right side of the patient by 2 millimeters. Mandibular midline is not visible, and buccal corridor at within normal. Here you can see the shift of the maxillary midline by 2 millimeters. Then the profile analysis. In the profile analysis, she has a normal facial convexity, nasolabial angle is obtuse, maxillomandibular prognathism, she has a retrognathic maxilla, and the vertical proportions, she has increased lower facial height. Then the assessment of the nose. First angle is the nasofacial angle, which is 30 degree. Then nasomental angle, which is 125. Mentocervical angle 110, and the submental neck angle 120. All are within normal. Then lip position, according to E line, she has a retrusive of both upper and lower lips. Person line also, she has a retrusive upper and lower lips. S line, both lips are flat, and Z angle within normal 82. Interlabial gap, she has a gap of 2 millimeters. The problems we have seen in the analysis, I have divided into 3 categories: anterior posterior dimension, transverse, and vertical. From anterior posterior dimension, she has a skeletal problem, one problem, retrognathic maxilla. In soft tissue, she had a flat upper and lower lips, obtuse nasolabial angle, retrusive upper and lower lips. From the vertical dimension, skeletally, she had an increased anterior lower facial height. Dentally, she had a occlusal plane cant, roll deformity toward the right side, and flat smile arc. From the transverse dimension, dentally, she had a maxillary midline shift toward the right side by 2 mm, and soft tissue, narrow mouth relative to the interpupillary distance, and central fifth wider than the medial fifths. These are the intraoral photographs for this patient, front and left and right views, cephalometric radiograph, and post-treatment photograph. And thank you.